Okay, good afternoon to everybody, and also good evening to those colleagues who joined live also from other continents, from Europe or from Africa, Middle East, and Asia. And welcome to the webinar on impact evaluation. What are we learning from them that we wouldn't otherwise? This is an initiative organized by 3IE, that is the International Initiative for Impact Evaluation, from UNEG, that is the United Nations Evaluation Group, and from UNWomen. I'm Marco Segone. I'm the chair of UNEG and also the director of the Evaluation Office of UNWomen. I have the big pleasure to introduce you today our keynote speaker, who is Dr. Jyotsna Puri. She is the Deputy Executive Director and Head of Evaluation at 3IE, and I'm sure that she will also briefly tell us what 3IE is for those of us who maybe are not so familiar with that. So Dr. Puri will address impact evaluation of real-world development programs and use examples to discuss how impact evaluation are increasingly being used to shed light on important questions that can help inform not just what works, but also how programs may or may not work and how they are delivered. Dr. Puri will use examples of health, humanitarian assistance, and environment to discuss some of these learnings that are overturning long-held beliefs. So with this, I would like to give the floor to Dr. Puri. Once again, thanks a lot for joining us today. We're very glad and honored to have you here, as we know that you have to know that Dr. Puri is one really of the, if I may say, guru of impact evaluation, but most importantly also on how to apply impact evaluation in real-world development programs and how to use the findings, the recommendation of impact evaluation to inform policy making. She's also teaching at the Columbia University. Actually, that's the reason why she's here in the United States. Usually she's based in Delhi, India. And so I think we are really privileged to have Dr. Puri here with us. And we are looking forward to hear what you have to tell us today. So the floor is with you.
Thank you so much, Marco. And you from me too. Really, the privilege is mine. I'm really tremendously honored to be here with all of you and the people who are logging in and watching this webcast. So I'm going to talk to you a little bit about impact evaluations. What are we learning from them that we wouldn't otherwise? And at the end of this, I'll talk a little bit about the organization that I want to. So I'm going to talk about four things. Yeah? The first one, it's not just about the money. Second, some things aren't as simple as they look. Third, the media is not just a mirror of society, and it's not just helpful to win elections, it's much more. And last but not least, the UN can actually be very effective. So I'm going to try and see what are we learning from impact evaluations that are helping to overturn some of the shibboleths or some of the things that we've held onto very strongly in our minds for a long time. Okay, before I go on, I just want to set, our understanding of language and what I mean by impact evaluation. Yeah? So I'm going to use the following definition of impact evaluations. Impact evaluations are evaluations that are looking at change that is causal. So they are able to relate the program, the intervention, the policy to effect, and are able to say in a causal way that this is what is causing the change. Second, they are, at least the way we are using impact evaluations, they're able to measure this change in a quantitative way. Third, they usually have a theory of change, or at least impact evaluations that we do require that there be a fairly strong, well-founded theory of change. Fourth, they usually use mixed approaches, so this is not a debate about quantitative versus qualitative. Advocate, stress on, emphasize, require mixed approaches. And last but not least, they need good monitoring work to have been done because implementation fidelity is key. Okay, So now that I've set that, let's just go and look at each one of the 4 messages that I've spoken about. The first one is, it's not just about the money. And if that wasn't sort of tautological, let's think about what the example here is. In a lot of the work that we've done, I think academics have done, that we're trying to undertake in different aspects of development as well as humanitarian assistance, one of the key questions is really what can help to increase performance and delivery effectiveness. Yeah? And the example that I'm talking about today is set in Pakistan. And the big question here was, what forms should performance pay take? So imagine sort of the scenario that I'm talking about. Pakistan is a country which is very much like a lot of other developing countries where tax revenue collections have not been very good. In fact, a lot of developing countries show poor performance in terms of tax revenue collection. But even amongst them, Pakistan has not done extremely well. So the government of Punjab, which is a state in Pakistan, province in Pakistan, then spoke to a group of researchers, Adnan Khan, who's from the IGC, Aslam Khaja from Harvard, as well as David Olkin from MIT. And this is a study that Sri supported, to then look at what can increase the effectiveness of revenue collection with their tax officers. And they had, in Punjab, 482 tax circles. And they tried everything. So the big question was, yes, we want to increase tax collection. We know incentives work, but we don't know what kind of incentives should be provided to these tax collectors so that we can increase total revenue coming from tax collection purposes. What the study did was it looked at 3 different kinds of incentives. The first one was performance based on variance. So there was a benchmark that was agreed upon with senior level management within the tax department, which said, well, this is the average level that we expect on the basis of past performance tax collection to be done. And then anything above this that is collected by tax collectors within these tax circles will be incentivized. So they will be given an on variance. Yeah? The second one was very much the same, except it undertook supervision. Supervision to understand as to whether the tax collection that was being done by these tax collectors was an accurate representation of what was due by these households. And to also look at citizen satisfaction. So the tax department was very keen that if all of this very aggressive tax collection does not lead to adverse consequences in terms of citizen satisfaction and ire towards their own department. So there was a second group that had the same structure in terms of incentives, but they had an additional supervision element to it. And last but not least, there was a third group of tax collectors that were given an end-year bonus. What did they find? They found that actually, with performance based on various tax collection went up by 12 percentage points, and this is in a span of 2 years. So it was extremely effective. But this by itself is not, earth-shaking. What was interesting was they found that where it worked was where simplicity was ingrained in the tax collection on various and the schematic that was put out. So simplicity was key, so that people could understand as to what benefits they were going to get if their tax collection efforts were being effective. And so the more complicated, the less effective the performance pay schematic was. And second, citizen satisfaction was key. It was only when citizens themselves were satisfied did it lead to greater collection of tax revenues than when they were not. This emphasis or this look at what is working in terms of creating incentives for people, whether they are frontline workers, whether they are workers on the ground, implementing development programs or even humanitarian programs, has now been looked at variously by a whole lot of other studies. In another piece of work, and this is well, a large body of work, now social recognition and the value of recognizing good performance within communities that people belong to, that either development workers belong to or humanitarian assistance workers belong to, or even just regular people who are in their jobs. If they are socially recognized within their own community, that has been shown to increase performance dramatically. And one study that has looked at this is a study that's located in Zambia that was looking at the distribution of female condoms, where hairdressers were essentially put together and given different sorts of incentives, financial incentives, one group, but another group was given was essentially promised social recognition. And they found that social recognition really increased their performance. And last but not least, simple nudges help as well. I don't know if you know about the behavioral insights team that has been put together by the government of the UK now. In 2010, this was set up by David Cameron. And they were essentially asked to use behavioral insights to then cautiously increase the effectiveness of their policies. There's a wonderful book on this called Inside the Nudge Unit that I'm going to encourage all of you to try and read. But it describes this experience and also some of the messages. And what they did, and just a quick example of this is, again, they were looking at increasing their tax collections from households that owed taxes. What did they do? They tested one additional line that was put into letters that were sent to households that was, the line was most people pay their taxes on time. That's just the additional line that was put in, and they found that their tax collections increased by tens of millions of dollars without an increase in cost. Okay, so key lesson one, effective delivery requires better thinking about how we are structuring incentives, and nudges and social recognition can help. Okay, now let's look at the second method that I want to think about. Some things aren't as simple as they seem. This reflects on my experience when I was working at the World Bank, and we were thinking about a pretty big question that's become relevant now, which is, do protecting large swaths of land, do they reduce deforestation? And one would think this is a fairly simple question, right? You protect forests, you create national parks, it should lead to a reduction in deforestation. But there is a twist in the tail. Think about where is it that most areas that have forests are located. So I looked at actually northern Thailand, and this is an area of about 170,000 square kilometers, where in 1985, although the government of Thailand had decided that 15% of their land needed to be under forest cover, it was diminishing rapidly, and it was down to now 10%, and the government of Thailand was thinking about, well, what is it that can help us prevent increasing deforestation? And so they started to think about, well, in our protected areas, and all the green areas on the map are all protected areas of parks or wildlife sanctuaries. Are they effective or not? So we looked at this question, and this is the elevation map of Thailand, and the little white squiggles are actually where the parks themselves are located. Yeah. Now, the lighter the gray area, the flatter the land, the darker the gray, the more highly elevated the land. So, just a look at this map will show you that where land is actually flat, it's where it's most clearly, because proper access is very. But forests are really remaining forests, and this is in 1962 to 1985. Remaining forests are clearly in areas which are high elevation, therefore high slopes, and that's where most of the forests remain. So most of the protected areas or most of the parks are clearly being located in areas that are fairly remote, that are fairly highly elevated, and also have steep slopes and that sort, for example. Yeah. So this leads to what's called program placement bias. Areas that get protected are those that have forests, but usually these are also areas, because of the high elevation, high slopes, bad soils, etc., that they have low agricultural profitability. So forest programs are usually bringing in these areas that are have low agricultural profitability. If you account for this placement, to what extent can we then say that forest programs are really being additional? That they are additionally protecting forests that would have been deforested otherwise. Okay? And this was the big question that we wanted to ask: does protection work? In the naive sort of framework that we looked at, and if you just looked at protection, and let's look at whether there are forests inside. Of course, there are forests within protected areas and within wildlife sanctuaries, all of those areas. And in the model that we ended up looking at, there is almost a 600% increased likelihood that you're going to find forests within national parks, wildlife sanctuaries. But if you account for what's called this program placement, there was actually no additional effect in this static model. And I want to say with a huge amount of humility that I'm not trying to say that you shouldn't have protected areas, you shouldn't have parks, and you shouldn't have wildlife sanctuaries. What I'm trying to say is that it's really important to account for this program placement attribute before we start to think about the effectiveness of programs, especially as we're thinking about additionality. I want to use another example of the effect, which looks at the effectiveness of public programs in India. This is one of the largest public programs in the world, which is called the National Rural Employment Guarantee Scheme, which is put out by the government of India, and it's essentially a cash for work program. And it says that if people living in rural areas are interested in getting cash, they need to work, and they can work for up to 100 days, and they essentially get 150 rupees or whatever the state level wage rate is for each day of work that they put in. Almost, well, the entire rural population is eligible for it. But what is interesting is that it has some of the lowest uptake, even amongst the eligible population. Only 42% of the eligible population actually uses this program. Yeah. This was the big question that the government asked in the government of Bihar, which is a big state in India, which then asked a whole group of researchers, and this work was done by Abhijit Banerjee, Nestor Duslo, and Santosh Mathew, who is actually a bureaucrat in the government of India. And they wanted to understand, well, to what extent is this not a demand issue, but a supply issue? One of the solutions that they thought about was an e-governance program. An e-governance program which essentially said, well, yes, we know that money comes down from the center, down to the state, down to the district, then to the block level, then to the panchayat, which is essentially the village level government system, and from there it gets distributed to the end beneficiaries. But what if we took out some of these levels? And what, hindsight is 2020. Of course, now once you think of it, this should reduce, this should increase the efficiency of these disbursements. But really what they found is when they put together the period change, they found that on the supply side, because there was a lack of trust amongst the people who were the beneficiaries, they weren't involving themselves in this program. So they said, let's have this e-governance program, and what they found was that with the e-governance program, NREGA disbursement expenditure actually dropped by 25%. But that in itself is not a good outcome. In any case, there was only 42% of the eligible population that was using this program. It was further driving down the total disbursement. But what was interesting was wages and the number of beneficiaries remained the same. So people, the end users, were still the same, and their wage bills were remaining the same. So what was happening? What was happening was that at the same time, ghost beneficiaries in between were disappearing. Yeah. And this e-governance system, that's what it helps to do. It helps to remove this middle layer of beneficiaries that had clearly participated in a very profitable way. Yeah. But we also found that there were delayed payments. And one of the key findings of the study also was that it's really important to train people in the functioning of these new systems, which in itself is fairly intuitive. But it delayed payments hugely, even more than what it was. And so now the government of India is thinking about using e-payments in a lot of their public expenditure programs across the country. But they're also thinking about training a lot of their workers before they install these systems. Okay, so lesson 2, checking the assumptions about what works out, definitely, but assessing the direction and the magnitude of placement size or program placement helps to understand as to where programs can be additional or not. Okay, the third thing that I want to talk about is media health, and it's not just a mirror of society. And this is one of the studies that is being undertaken to then understand to what extent can media help to change people's attitudes. Now, the map that you're seeing on your screen, the left-hand side map is really showing the darker the area, it essentially means that the greater the percentage of women who are exposed to media. On the right-hand side, you're seeing total fertility rate. The darker the state, the lower the fertility rate. Yeah? So that means there's an inverse correlation between exposure to media and fertility rate. You're not saying, of course, as to what's causing what. Yeah? And causality can go either way. But in any case, what Robert Jensen and Emily Oster in their study of India in 2001 wanted to find out was, is cable television, where programming is really very, very different from state-sponsored programming. Cable television programming typically will have women who are much more empowered, are outgoing, are professional, much more autonomous. So given cable television programming, whether this was leading to a change of attitude amongst women, but also amongst others. And they looked at this question between 2001 and 2003 at a whole host of states in India. And they measured attitudes of women, on 3 different things: tolerance of domestic violence, women's autonomy measures, and sun preference. So just as an example, as you may know, tolerance of domestic violence is really measured, when women are asked 6 questions. Do you think it's okay for your husband to beat you if, 1, you stepped out of the house without asking him; 2nd, you've burnt the food; 3rd, you haven't looked after the children; 4th, you've refused him sex; 5th, you've been rude to him; and 6th, if you've done something that he didn't want you to do. What they found, so in 2001, when they measured women's own tolerance of domestic violence, this was an average of 2.2, which means that across the board in the states that they were doing this study, there were women found it was fine in 2.2 reasons for their husbands to come and be violent with them. After the introduction of cable television, and yes, it does with a lot of what are called indigeneity questions, but after this study and this evaluation, they found that cable television, which does have very different programming, had led to a reduction in tolerance of domestic violence, down from, in 2001, 2.2 to 1.9 in 2002, and then finally to 1.75 in 2003. Unfortunately, it was only a 2-year study. Okay. So, lesson 3, using media effectively can help in bringing social change and not just winning elections. My last message that I want to try and explore today is that the UN can actually be very effective. So this was a study that was done by Chris Blackman and his colleagues in Liberia. And they were looking at the context where conflict had been huge, especially after the Civil War and after a lot of ethnic strife. So they wanted to understand whether there are other dispute resolution mechanisms that might help. This was an area where the courts were essentially being overburdened. People were using inefficient ways, so even though they were using traditional fora, where they were looking at informal and customary dispute resolution mechanisms, they were going to village elders. What they were also doing was that they were shopping for resolutions that favored them, which meant that basically disputes stayed on for years and decades. It meant that there was a huge amount of violence and conflict, and people just didn't resolve it. So they worked then with UNHCR to then devise what's called a training and education program to understand if there, and this was done in 3 areas in Liberia, where communities were chosen to be given different sorts of training, education and training campaign and 15% of the population of each one of these communities were then subjected to these education and training campaigns. And they found that it actually helped to reduce, over a period of 2 years, reduced land disputes by 28% in the areas where people or village, the adult population, 15% of the adult population that themselves were chosen and selected by the village elders to participate in these training programs. It reduced the frequency of disputes by 28% and reduced dependence on formal courts and therefore reduced the cost to the exchequer essentially by 24%. Yeah, so I think the numbers themselves are not so important to note, but really to be able to inform both the direction as well as to be able to say confidently that these dispute resolution mechanisms were working was extremely useful. So the implication was that really behavioral and institutional change is feasible with broad education and training campaigns and with training campaigns. Okay, so I'm going to try and stop here and quickly summarize the 4 things that we learned. One, it's not just about money. We should be thinking about how to construct these performance incentives, nudges, and social recognition can be extremely effective. Second, media can be very effective in changing attitudes, and they're not just there for, changing elections. Some UN resolution mechanisms, if designed well and implemented well, can be very effective. And last but not least, implementation is key. So, the example is the e-system, especially from UNEG, where leakage is reduced by 20%, but it's really important to account for unintended consequences. I want to say thank you very much. I did promise that I'd talk a little bit about 3IE. So 3IE stands for International Initiative for Impact Evaluation, IIIE, so which makes it 3IE. We were set up in 2008 after, I think, a huge amount of global dialogue on how little evidence there was to inform whether development was working or not. So development and 3IE's mandate is essentially to generate policy-relevant, high-quality, credible evidence in areas that programmers, strategists, as well as policymakers are really interested in informing. Thank you so much.
Well, thank you very much. Thanks a lot, Joe, for a very interesting presentation. I have to say we have more than 50 participants online, so now it's the time of a question and answer. So while you get prepared with your questions, both here in New York as well as online, for the participants online, they can just write in the chat, right?
Yeah, you can write in the chat or you can raise your hand, so we're going to see you like call your name.
Okay, so either you virtually raise your hand, or you write or you write in the chat, and then maybe Jason can read it. But just to say just a couple of things. First of all, really an acknowledgement once again of the 3IE contribution to the body of evidence for international development. And so I think it's something that's always very important to do acknowledgement. And I think that from your presentation really is very interesting to see how impact evaluation they can reduce the program bias. And we gave a couple of examples, very straightforward example on the cost beneficiaries in the case of the India employment scheme, or the location of parks in the case of the deforestation programs in Thailand. I think here are the first questions probably coming up. But also a second aspect, especially from if I can put one second in my head as a UNWomen, in the case when you were mentioning about the case of people in India, to the women's status, etc., or to the tolerance of domestic violence. So just to say that for impact evaluation, sometimes we think that impact evaluation is only about hard data, quantitative indicators, and things that you can measure, kilometers of road and etc. But what we were saying is that actually it can also be about measuring the changes in behavior, in social norms, in cultural beliefs, etc., like in the case of tolerance of women towards domestic violence. So I think that was very interesting to hear. So with this, without taking too much time, I would like to open the floor for the questions. Perhaps if it's okay for the colleagues sitting in New York, we can give the preference to the colleagues sitting everywhere else in the world. And it looks that Russell, he would like to.
Yes, I'm here.
Okay,
hear me?
So we can hear you. So please go on.
Well, first of all, a quick word of thanks for a good presentation, lovely examples, and what a pleasure to see someone who has lots of pictures and just a few words in their PowerPoints. I really appreciate that.
Thank
So
you.
my question is actually about impact, and I just wonder if you could clarify a little more of what you see as impact, because it looks like we have 2 or 3 definitions of impact. There's the impact according to the OECD development evaluation criteria, which is any change intended, unintended, etc. And then when we're talking theories of change and results chain diagram, we use impact to mean the societal level changes right at the end, 2 or 3 years down the road only, and not all changes. And you're using it, and I have no objection. I just want to make sure that we really are talking about 2 or 3 different things. You're using it really much more like the OECD definition, that any change brought about, it doesn't have to be at the societal level, it can be almost anything. Have I understood that correctly?
Yeah.
Okay, perhaps if it's okay, we can see there are another couple of questions, and then maybe we can take those questions. So thanks a lot, Russell, for these questions. Is there any other question or comment from the colleagues online? So from the colleagues here in New York. From here from New York.
Yeah, I'm coming from DSS, and probably my question is more based on your own experience. 3IE is the application specification you were talking, right? My question is, for example, the first example in Pakistan, we said the result of the evaluation, social recognition, implementation, or the importance in deciding that they can see the impact. So in this kind of evaluation, when you have actually the results, what about your clients' feedback on that? The way that you communicate with your clients, particularly in relation to your final results of the evaluation, Is there any kind of mechanism that you reflect their feedback or their comments on the final findings? How to make sure that you satisfy your client's expectation level?
Thanks a lot. And then we have also from Shirin Ali. She's asking you to kindly share with us example of gender responsive impact evaluation.
Yeah.
Okay, so we have three questions. So, what's my region?
Thank you. Thanks, Dirk. I'm going to take them in order. First, I think it's Russell's question. Thanks, Russell. So Russell's question, just to recap, what definition of impact am I using? Is it the OECD definition with basically any change, intended or unintended consequences, or is it more social level impact? So let me, there are different definitions of impact, as you yourself have said, Amanda. I think what we emphasize is that the impact that you want to measure is really, and this goes to Song Lim's question as well partly, is really determined by the people who want to understand the change being brought about by their program. Yeah. So if you want to understand, for example, malaria incidence and prevalence, you could, if you have a really good, strong theory of change, be just measuring number of people living under treated bed nets as essentially a really good proxy of impact, because you know that the part of the theory of change that links people using long-lasting treated bed nets in the correct way. The coverage of long-lasting treated bed nets, for example, in a community, and malaria incidence and prevalence is extremely strong. So given that you have a fairly strong linkage between what would in other analyses be an outcome and your overall impact level is fairly strong, then an evaluation that just looks at the outcome, the changes in outcome, would be absolutely fine by us as well, as long as there's legitimacy in the strength of the log linkage. Okay? So, yes, the examples that I've shown, Russell, do talk about change, and I think the overall definition that we try and remain as agnostic as possible about the definition of what impact is, because, like I said right at the beginning, we really need strong theories of change to inform any evaluation that we support. I'm going to go to the second question, which is from your question. What about the client? What about their feedback, and how do they engage with the final result? So, again, really good question. One of the things, and I only have 25 minutes to talk about the stuff that we've done for impact evaluations, but one of the things that I will be talking about will be is that we realize that it's, and this is probably all old hat for a lot of you, but it's really important to have the clients re-engage with the evaluations right from the beginning, irrespective of what the results are, because they need to own them. So just functionally and operationally from them, what that means is that when we, even before we sign an agreement with the team that comes on to do the evaluation, and we support them, we manage them, etc., we ask the team to spend about 2 to 3 months really immersed and working with the team that they are evaluating. There needs to be, even during what's called our inception workshop or agreement workshop, which we do, the representatives from the implementing team, what you would call the client, need to be there physically, thinking about the theory of change very closely with the research team, so that they can inform whether the question itself that's being asked is relevant and useful to them. And then they need to be present in very substantive ways through the life cycle of the evaluation. So it's not as if they're getting to see the results of this right at the end. We've developed what I call so of course the evaluation teams are talking to us, they're sending us monitoring reports, and they're sending us progress reports. But what they also send us are stakeholder engagement and evidence uptake plans, which they then report on simultaneously with a whole lot of other stuff that's going on. And I think what that is, the emphasis on policy relevance and usefulness is really key, because this is one of the raison d'etre. I mean, this is the raison d'etre for 3ID, that we have to bridge this chasm between researchers who are essentially looking at questions, but clearly questions with the lens of, well, what can they publish, and real-world development programs where you really need evidence. Okay, the last question was on Shireen on gender responsive. So I have the expert sitting right next to me on this. What I want to say, Shireen, is that yes, we support gender responsive evaluation. Again, we need people to come to us, and people who are interested in gender responsive evaluations to come to us and say that they would like to be looking at. Again, I can parse sort of gender responsiveness into different dimensions, and my folks will, I'm hoping, correct me. But it can be looking at, so that it is responding to how the program itself is getting implemented in a way that is gender responsive, so that the evaluation and the different questions that the evaluations themselves are asking are being done in a way so that the disaggregated and disaggregated data is being collected so that it's represented for both genders, for example. And I mean that in the biological sense. Of course, there are you can self-identify yourself as different genders. So we look at that, and we are analyzing our own portfolio at this point to understand as to what has been the demand and what has been really the push for these sorts of evaluations. We haven't come out with the results yet, but a large part of it is really demand-driven. And we ask that the people and that the organizations that work with us do think about this as a work as they come.
Thanks a lot, Joe. So we are hearing your call for us to demand more CIE for more gender responsive impact evaluation. So just a very short bracket for publicity, just to say, if you're interested in gender responsive evaluation, both UNEG as well as UNWomen have developed guidelines and a handbook and manuals on what do we mean with gender responsive evaluation, how to manage gender responsive evaluation. And they are obviously available free of charge in the internet, so just go to the UNEG and UNWomen website, and you can find them and download them. Meanwhile, we have 3 additional questions from the colleagues online, and you can also, I will read, but you can also look at it. One is from Aftamu, is asking, is there any specific impact evaluation program that will be studied under IPC in sub-Saharan African countries? The second is from Valentina. When you talk about the NREGA in India or tax payment in Pakistan, how big is the sample you choose? Do you cover the whole country, or do you do the results? And then we have another one from Sofia. In a recent presentation by J-Pal, we hear the perspective that randomized control trials are the only sound way to assess the effectiveness of program intervention and to understand the causation. What is your perspective on this? So, 3 additional questions. Yeah.
Cool. So the first question, which is Haftamu, the question is there specific impact evaluations programs that were studied under IPC, and I don't know what IPC is in sub-Saharan African countries. So if you can start that, let me know. So that's IPCC. So I know IPCC, but I don't know IPC, so if you tell me that. But yeah, we do actually have a lot of evaluations that we do in sub-Saharan Africa. In fact, we are also starting an entire new program in West Africa, part of which intersects with the sub-Saharan region,
And we work very actively in Malawi, Kenya, Uganda, Tanzania. We work with the Office of the Prime Minister in Uganda and various organizations in Ethiopia, with the governments in Kenya, Ethiopia, Malawi, and Rwanda as well. Okay, second question, when you talk about UNEG or tax payment in Pakistan, how big is the sample you choose? Did you cover the whole country? Did you choose a big? Great question. I'm so glad that you asked it, Valentina. Almost all of the, well, no, all impact evaluations that we end up supporting need to be asking questions so that they can answer the question in a statistically confident way. So I will not let, the team will not let an evaluation go past if it's not powered, yeah, for measuring at least the primary outcomes that you've identified. So if you've identified, for example, domestic violence or tolerance to it, or in this case, you've identified employment and payments, etc., you do need to be able to indicate to us that the sample, the data for which that you're using for your data collection, but for your quantitative data collection is sufficient for you to be able to measure your primary outcome or outcomes. This in itself, of course, as you know, is dependent on what is your baseline value of the variable, what is the effective effect size that you expect to see. So is it a 10% change or is it a 20% change? The larger the change that you expect to see or that you want to measure, the smaller the sample size you require. Yeah? You need to have a whole lot of other statistics as well. For example, your correlation measures, your variance in your baseline population, all of those need to be taken into consideration. So yes, these are fairly rigorous proposals that need to come to us. And we do work very closely with the teams as well when they are setting up these evaluations. In both cases, in fact, in all cases, these evaluations were powered for their primary outcome. In UNEG, actually, they did not look at the whole country, so they looked only at the state of Bihar, and in the tax experiment in Pakistan, that was only done in Punjab. Punjab, it was 482 tax circles that were looked at, and in the UNEG example, it was definitely the total number of groups that were looked at was less than 100. Oh, sorry, less than 200. Sorry, I don't know, but at the level of the community, yeah. So that was for the expected effect that they wanted to measure. That was sufficient. That was sufficiently powerful. Japan had the perspective that randomized control trials are the only sound way to assess effectiveness of program interventions and to understand causation. What was my perspective on this? Clearly, you have to fit the method to the question that you're asking. Yeah. Even amongst the examples that I presented, actually, there were a couple of examples that did use randomized assignments, but there were quite a few examples. For example, the Thailand case. There was also the India, where you're looking at cable television and women. All of those did not use randomized assignments. I think this debate of whether you should randomly assign or not, essentially, or have randomized control trials, again, is not really the question you want. You want to fit the method, the best method that you can put together for the question that you're asking. If the question that you ask me is, Joe, yes, this program caused this change, then I have to ask you to identify or I will work with you then to find out the best method and there are a whole host of methods now to then identify what that causal relationship is. If you want to measure correlation, then clearly your methods are very different. So you can use randomized assignment, quasi-experimental methods, a whole host of other methods. I think my only takeaway is fit the method to the question that you're asking.
Okay, thank you very much, Joe. I see there are several more questions online, but unfortunately the time is running out. So I would like to invite you, for those who put the question and we did not have time to answer, I'm sure they will be available to do that online and press. Yeah, either by Twitter or by email. So I think that one is
yeah, I'll put my email address.
Is your tweet and otherwise by email. So once again, thanks a lot for coming here and sharing your experience with us. We really appreciate it. And thanks a lot to the about 60 participants, mainly from those who joined online. And you know, this is kind of series of webinars that UNEG is organizing. And actually the next one, 23rd of February. You want just to say what?
Okay, the next webinar would actually the joint webinar is released, and also the use of evaluation working group on the use of evaluation. And we'll actually already send out an announcement. We will send a reminder again. And I would like to get information. You can also email us if you didn't get it yet. Our email is uneg.contact@undp.org.
Okay, thank you very much, Jean. So we hope to see you in the next webinar. It will be about the use of evaluation. And once again, thanks a lot for joining us, and let's keep in touch. And thanks a lot, Joe, for the presentation.
Thank you. Thank you, Marco. I think Jim said that a PDF version of the presentation will be online at the UNEG website.
Yes.
And we also add my email address, so if people want to go.
And also the recording will be available for those who were not able to join us today.
Thank you.
Thanks a lot.